Turning now to the coronavirus pandemic. It has grown to more than 19.3 million cases in the United States, and more than 335,000 deaths are associated with the coronavirus right now. And with the vaccine rollout well underway, Governor Cuomo is saying that he plans to sign an executive order to fight against vaccine fraud, as it was found that some people have been jumping the line, so to speak, in receiving the coronavirus vaccine. We're joined now by infectious disease physician Dr. Payal Patel. Dr. Patel, I want to start on these vaccines. They're such a hot commodity now, I guess I could call it. I want to take a listen to what Dr. Fauci had to say about how many people have been vaccinated, or should I say, have not been vaccinated yet.
Well, we certainly are not at the numbers that we wanted to be at the end of December. You heard talking about 40 million doses for 20 million people. I mean, even if you undercount, 2 million is an undercount. How much undercount could it be? So we are below where we want to be.
We are below where we want to be. That's not really great news, at least to my ears, when we're talking about this pandemic. So, Dr. Patel, when you hear something like that, do you think, okay, this pandemic is going to continue? We had been saying fall of 2021, everyone was going to be vaccinated. When you hear that, do you think, okay, it actually might now be 2022 before we have everyone in this country, at least who wants to be vaccinated?
I think it's really important to have lofty goals, right? When we think about vaccination and getting people vaccinated. And it was a really good goal to get that many people vaccinated by the end of the year. But if you think about how quickly hospitals and healthcare systems have been rolling out the vaccine, within 24 hours of it being approved and getting the EUA, people were getting vaccinated. So we have millions of people who have already been vaccinated, and going into the new year, things are going to continue to power up and rile up. So I think that I would make that a lofty goal, but we're still on track to get millions of people vaccinated before the end of the new year and going into the new year.
You know, it hasn't been very long in this rollout, and we already hear of fraud attached to receiving the vaccine, as some people are, kind of jumping the line, because there is a priority list that we have of who needs to receive the vaccine first, who can wait a little bit longer. And we already have some people jumping the queue right now. When you hear about that, how does that unevenness in the distribution of the vaccine, how is that going to impact the pandemic if some folks who don't really need the vaccine start to get it well before folks who really should be prioritized?
Yeah, I think that, so far the rollout has been pretty straightforward. There's been a lot of thought put into who are the first groups that should get vaccinated. There's a really interesting article by an ethicist today in the New York Times that talks about this very topic. I would say it is important that we try to adhere to what ethicists and infectious disease doctors and pharmacists have all come up with, so that if we get those frontline workers vaccinated, we know that our hospitals and healthcare systems will continue to be able to provide care, and the frontline workers who have to go to work every day and aren't able to stay home can get vaccinated, and the people who have the luxury of not being able to be out in the community can continue to protect themselves by staying home. This is the best way to move forward so that we get the whole country into the new year in a healthy way.
So, listeners who were listening, at least in the previous hour, heard of Zach talking about how he traveled for Christmas. I myself also traveled, and the both of us traveled by car with my bubble to an empty house where we could maintain our bubble. But I'm wondering, do you think that this surge that we are going to see this time around, this post-holiday surge after Christmas, after New Year's, could be the worst that we've seen compared to the surges that we perhaps saw after Memorial Day, Labor Day, Independence Day weekend, especially since we're in these winter months?
Yeah, I think there's a lot of factors that go into winter showing us an uptick in COVID cases. So there's holiday travel, but there's also just the fact that in many states, it's too cold to be outside. So there's more and more people that are in an enclosed space kind of closer and closer to each other. There's also a number of other viruses that happen in the winter time, and that can all kind of rile up. This is a really important time. I know everyone's having some fatigue with the pandemic, but it's still a really, really important time to stay home because those rates out there in almost every state are very, very high. So this is the time, the vaccine's coming. If you want to protect yourself and your family, it really is a good time to really listen and stay home.
All right. Definitely some good advice to heed there. Dr. Payal Patel, infectious diseases physician. Thanks so much for joining us today and just really breaking down all of that information throughout this pandemic.
Thank you.